Hello, everybody. My name is Mackenzie, and I'm going to be discussing dehydration. Dehydration occurs when the body has an excessive loss of fluids, inadequate fluid intake, or a combination of both, leading to insufficient fluid to carry out normal cellular functions. Fluid losses occur most commonly in the extracellular compartments. Water shifts from the cells to compensate for fluid losses, such as fluid losses from the GI tract due to vomiting. If the fluid deficit continues, cells lose fluid and cellular function is impaired. Electrolyte changes can also can occur with loss of fluid, and that can lead to osmotic pressure changes between compartments, which require replacements of both fluid and electrolytes. Anyone of any age is at risk for dehydration. It can simply occur with someone who's healthy at work and just is not drinking an adequate amount of water, such as nurses working 12-hour shifts and are not drinking water. Infants and elderly people are at increased risk for dehydration due to their lack of fluid reserves. So a less amount of fluid loss can cause dehydration in this population. Athletes or those working in high temperatures outside are at increased risk due to excessive sweating, lack of water intake, having an illness that's leading to diarrhea, vomiting, fever. These are all conditions that lead to fluid loss. Those who are diabetic and those who are on diuretics are also at increased risk for dehydration. Some major signs and symptoms of dehydration are having dry mucous membranes, having decreased skin turgor. So you can test this by squeezing someone's skin on their hand, and if you release and their skin doesn't go right back to being flat, that's a sign of dehydration. Having a lower blood pressure and a weak and rapid pulse are also indicators. Decreased urination, also known as oliguria, and having increased urine concentration are signs of dehydration. If you're looking at someone's urine and it's looking really yellow or dark, that is an indicator of dehydration. Headaches are pretty common with this condition. And when there's an excessive amount of fluid loss and the brain has a reduced fluid capacity, people can experience decreased mental function, confusion, and even loss of consciousness. Some diagnostic testing that can occur, it's most commonly done by just looking at the patient's physical signs and symptoms, what the patient's reporting of what they're experiencing. Blood testing can also be used to detect electrolyte imbalances. Increased hematocrit is common with dehydration, and blood tests can be used to assess serum or plasma osmolarity and osmolality. Performing a urinalysis will show increased specific gravity typically, and changes in body weight can also be used to detect dehydration status and fluid loss. Here are my references. Thank you so much for listening. Hope you have a good day.